FM Pachoko Facebook bra Facebook sisi bra Facebook Asempa 94.7 FM oba Facebook na oba na like page na di kan na afen so share pacho in discussion ehu hia yini amema pacho yo oba na uti ukunu de oni asema na ebeka ho asemi ene be di nsawoso inti tie bi menka se we ne de se mema de inti wo be sorry time Dr.Phil de bia ncheche no e kate across ubia so ye president to so ye minister so ye MP so ye presenter so ye doctor enkomo ibe die fa ho ye be hwe o prostate inti tie bi na fa to okotodwam na wasua bebre enso efrem na ne awon prostate ede awon wasam aba me amenua so many years Dr. Richmond Amo doc na ti saying
so
bibia da din ya da nyame ase etefo woko Facebook na o like na o share and share na be me bia onim no o share na bia manenti asemu bi no onhwe na o mehwe Dr. Richmond Amo me amenua anu aba doc na me do picture to obi say hey doc say that's oh yeah police no so film no say as a police for cat ni bi now the doc say as one person cycle police na anyway doc you're welcome you share check
thank you
over for 2 decades na a check kakra na be
since 2005 and
2007 yes a check papa but you born between but you say hu ye ho no a check ye me you're welcome right now and you be share prostate and the two questions be bri aba na eba sa na ese enu kofo be din sawoso nti ese e ka ho asem na ebeba no yedi kan ne Ghana fo di nkomo ebisa ese Ghana fo prostate kwa de na munim fa ho na mon kan de munim fa ho kire wo kwashi mimpo a to mani ne Dr. Richmond Amo waba enti yenti the Ghana for kana yamra why
say the causes of prostate enlargement and as a prostate in men I know I don't know but what medical reports have been saying say omu should need the actual cause of prostate in men as a prostate enlargement because prostate no organ a woni pemu
Asempa FM
prostate gland a organ a woni pemu and when the size increases or decreases means your prostate in your defect. Now I mean my grandfather may so rest in peace no was such and also was and also no suffer a prostate enlargement nibi. What I know was every 2 weeks be and also sometimes a week or hospital. Then the blood and I full no much so that the urine will come out. Na ya paidu baby na ya. Because ya or jun so anye enti no omo hospital. And omo share na rubber. Every we be an rubber no ma brother na yefo na akọ. Then they will take the urine out 2 weeks until say nyame eton side ya friend no. And that is the little bit I know about prostate
cancer. Arabia affects men and as a man. And it affects their prostate. Mami nim kakra fa on the omama insubi etumi efi wo bema no mo ede eba. Afin so no you find it very difficult to urinate and I say wo dwen so edi. At times, whether obey so frequently, and I say I feel the embakra, jeans on the embakra. Now, I've also learned say at times, any symptom be HSA when you prostate cra, but not prostate in the war. Into a cancer, so I can say a bear. This is a cancer of the breast near day. But this one a cancer affecting Bemano homo prostate. If I say, Beman and Casancasano, and Damiyari affects you. Kakra minim efa no. Nti say we Beman as a winya sa Arabia. The only time is say, start to say, Unya
Asempa FM.
Say who junsa o bre and I say who junsa no emu ache mienu ni ade a. The only thing I say wo be call hospital na wona hwe ama.
I've not read a lot about this prostate cancer, this particular topic, but there is one thing that I know that probably cancer can come from like probably the food you eat, like your diet. You should be able to take care of your diet. Yeah. Probably what you take in also becomes a factor of you getting or not getting like you should. Be careful with your diet. That's what I can say concerning this particular topic, because I've not read much about that. Because first they used to say when you load yourself with a lot of stuff, like you don't free your private part, wearing clothes like 5 or 6 boxes together and all those stuff, like it's counters to lose sperm count and all those stuff. So but basically like the real deal in this particular stuff is diet.
I want to crash mate afa prostate no say so prostate cancer. And also no matter, and you know, I mean, sometimes like I said, I confuse me the prostate enlargement and the prostate cancer. And what a little bit I've known about prostate cancer, and I say when you have prostate cancer, you find it difficult when you are urine, and sometimes you see I say brazier symptom maybe. Any sometimes when you pains, don't pay more any baby span. Holding on your pains near the air woman. And also,
Asempa FM.
What I know about prostate cancer. And you know, I don't know the difference between enlargement and the cancer. A little bit confusing to me. Once again, bet you about your 4 more Asempa 94.7. Some of this argument come be say about na abua na educate the lay people. We don't know and has any idea about prostate enlargement, prostate cancer, any dia cano. Send a it's here you symptoms be the earlier the better. You to me attended to clinic na problem no solve in time. But that must not pay. So mo boy man. I mean shramo. Any my pam boy that boy mine from Ghana.
Right, ain't the Ghana for enim efa prostate be a factor business and nam chain kakra doc inti pacho bonitofa na yenhwe mamenka say Dr. Richmond Amo no so oni Dr. Ruben Agbo and a buy or supporting a brapenyi on in the buy doc also akwaba
yeah
okay and one chino na edupika kra right doc English one pabro kakra do doc intino and yenhwe mamenka so show ni interactive with the questions or comments we be a chiwa dreams with him their fire WhatsApp line me say WhatsApp mpa chopa menia 0244 460 449 0244 460 449 and know your WhatsApp message inti bacho menu aba utie na utie bia ma ukunu a na utie ni bibi cho adwens so na the questions na ba mrepem no ye be kan na enu wadi ho nkomo doc and na utie enkomo ya ebisi prostate pacho edikan dey na correct prostate and prostate
bia mem some spelling
spelling na nkofo ho
STATE prostate.
Okay.
Prostrate. I'm saying a good question. No more time. Tight. Me prostrate. And you're prostrate. It is prostate.
It's prostate.
It's like prostate.
Okay.
Prostate. Then you're prostrate.
It's but more can prostrate. But I'm Dr.Phil and the actual say and you're prostrate. Prostate. Okay. Good. Doc na prostate there e woni pam awo ban mu ana obam mu nko a e ho asem te sen
Phil na me cha san cha o tie fo nyina
me da asibinua
e so o busa be 5 questions in one
ma shada pa
well prostate I'm say we so some address we
a
mema nko na o prostate
okay
the internet stress on this because on a Namiti, I checked Namiti radio some time ago, and I think somebody on I don't know the person, but no can't be this a male prostate. I was a bit surprised.
Really?
Yes, I've heard it on radio. You know, I'll say can I clear? Who said prostate? Remember, or bad being or prostate.
Okay.
It is when we are talking about prostate diseases. Just say, remember, you are any
yeah, can't have some. Oh, okay.
So, but remember beyond that down. Especially if sometimes over for car. No, you'll be General Sabi. Young cancer be but then because we're educating the public, it's what's bringing these things into the form. I say, come on, Matthias. If you'll be to draw care, and I say, do care. Now I started. Kind of give me to catch a sense of a background prostate to permit me or baby and or prostate. A member or prostate. Yeah, say anything. Ubusa terms of maximum, and I catch a prostate. A very simple structure. And then because I Nipadana quality. So, a war sabi. You do say the urinary bladder it wraps around the neck of the urinary bladder. Bladder near baby as a kidney, and I see a son produce urine, and I see a produce Joneswa. A fat drobem if an ureters, not a big goo. Your friend is a bladder, and urinary bladder. Now, I'm a reservoir, and son, I say a fool, and not yet Timia Jones so afa urethra, and not Jones let me a day. Abba. Now, the prostate is wraps one word the other. So, I say a fat, and I say bladder, no, and I say it wraps around the neck of the bladder, and that's at the base of the penis. And extends back into the perineal area and for the rectum. I mean, can I say? There's a simple structure, as I said.
Time, Doctor, for you to from cry. And the perineal, urethra,
mention say,
a petri fashion, mamma. So, to Doctor enter us.
You got a bladder, a year, almost saying, you nipid your son, and I say kidneys, no. And they produce urine. And I say, oh, produce urine, area. Now, kidney now, so there are two tubes, I have ureters. Drobem you know so baako be free kidney name you know baako left baako right and then say Johnson are produce na fam na be good bladder na ye men kan say a reservoir and I say grawa bia nso ni be guma Johnson ni be guma e ho ne be store na afidi ansa na ye ya Johnson afa say be be mem na say urethra nim na ye den atimi aba so hunu and make us prostate no e chichire na say men kan say it wraps and I say chichire bladder na no neck of the bladder. It's found there, or possibly at the base of the yasebi. No, the base of it. So, and that is where it is. Now, the major function I say you may deeper keseba kuni say. Almost say bema you produce common and then a better sperm. But in fact, the spermatozoa is produced from the testes and it is stored in the epididymis. And as I say, yeah, show my banner, a produce in common. In common, I was saying, so be a jarrum. So, sense soon and common, a because seminar fluid. In your and common jarrum, and I say common is a seminar fluid in caboma, in your semen. Now, you might prostate need dinner say. It is the organ it produces most of these were seminal fluids. What you say, Beya. It will say a big jarring common as and common be young soon made a jarrum as and put a bema to me a jat in whom so go about one. And one bit me a jarro sense when many of Banacusia day, Akushiyama day, Yinsiaba.
Okay.
So it's a very vital organ when it comes to fertility in men. And as a man can say, some pose common bit me in Sua jarro money or Bakusia Kushiyama Yinsiabano. The prostate is responsible for producing the seminal fluid. So that is also very key for procreation. Because it's
okay, say prostate. I am feeling who any pedia, for any who was so who any who sat and I home. Never be doing it to any, but when we show nipedia no more a hint towel. Nadoka case, my dear dino. Impo Bema, Obedu Mensah, saying Sua, every one back or honka for home. Nani shame so kwa Emma Akoka Nkusiama Sabi Brakwesi, na Brakwa may be a free mabano. Prostate do exactly. It sounds no. Now common Garo Mono, oh, I never see a form semen. And then prostate
produces a major part of it.
Wow.
So the prostate gland produces a lot of the seminal fluid.
In so na ejina yankwamo ho no. Be ma bia obe release wo ho kafo hye mu so na ba no.
Prostate is one your friend is sperm, your friend is semen. What you say? Semen. And now kwamo no from spermatozoa. So mo dose one and a spermatozoon say ba kopa.
Okay.
What you say? James sperm, sperm now ma.
Yeah,
James said a few things to correct. The yes in common is spermatozoa.
Okay.
So common in so in Asia and so free bema ba yes semen.
Why? Ma menka tie for say pacha bombra Facebook say ya che prostate no uni pedua na kwa baby e wo no ye che of Facebook say pacha bra Facebook wa Asempa 94.7 FM Asempa 94.7 FM bra Facebook say na ebehwe prostate na da ho as a golden color bi youth ra na ye Dr. Amo Parich and me born into hu di bi achemo and me kwan edim no shadake mpato hye no bia me mfre no hu se youth no na mu bo hu bladder no so na mu de say normal and then so bo say prostate na bi an large be duru ho nyina na sama ye ne youth no asa ye tia asa mia no kakra a constrict kakra nyina no ye behwe na ya kire nti bacho mo bra Facebook ba nso ampacho manya pesa minkuminya na share na onua nso nya bi nhwe na ono nso asua efrem enei ye pese the objective of today's show is be na bema member bebre wo Ghana na ya gem nkwansi ho say that for God and for country me no parich but me ka say enche ye be bie phone lines na wo so wanya mre na bibi eche wadren so eche wadren fa ensem ye be ke ka ho asemi na wo so de aba doc ene wa kire hia baby prostate na hye wa kire baby hu hia eche bombra Facebook na mo mehwe wo your Facebook live stream no was Asempa 94.7 FM and who be prostate nation doc prostate no the importance pa ne saying the importance humidity to be pa na di e woni pedua ni
I'm say question abusa first one Emma Maka and I'm kind of say the primary role and as a major role play ne say e be produce seminal fluid no them say make that point clear but I say timobium say produce seminal fluid na spermatozoa and asem common na ya produce for your body name no any sa seminal fluid ne fra na nya semen then so na common be dware mu a ebetimi ne oba na edai ehon kosua na edai akohia amanyinsan edai aba and the major role power play so be produce seminal fluid etimi aboa ma spermatozoa na ye produce and asem common na ye produce for your body name no enya baby pagina ohun se ne sitie no ewu nsuo no na etimi ene oba akosua omatimi asumi ne oba akosua hia na nyinsan edai aba sensu na so ye beka se unse a mass when you because it's acidic in terms of pH. Meaning acidic but seminal fluid no sometimes also is alkaline in nature. And I say because I know so basic. Into your course one way or the other, it tends to environment acidic a bit hostile. It come on and I say anti-me come on in young quantity and concominim. And some part of the rules were seminal fluid in plane is it's also alkaline in nature. So in one way or the other acts as a neutralizing fluid. As I can say any acid no a bit bread acid acidic environment no acid. Send a bay and come on a bit mede. Wunomian economic mede, assuming your banco and ede. It's also an important part because we all went through that process. Actually, that is the major thing.
Not just said me see the okay ya na prostate ya ka ho asemi not it has everything to do with procreation.
Yes.
A woman
yes.
It play an important role.
It plays an important role because you need the seminal fluid. Yeah. Don't say we am ka say nyankopon de ho. Hey.
Na de kitu e de to. Eh oge patwa safa to na nkofo nhwe. Ade kitu e ti hoi. Be ma osun wasen. We are Mr. Universe, we are then. I take it to any control say on come one. Musa na nkofo bebre me confused say otimi ne nkofo hyiam na hwe ma. Oso mitimi no hyiam. Nti adenti na wontimi mfaf ne de ha oba no.
Enzo free mo baba.
Na de kito ya open prostate. Eno na timi boa se ginasi yi a e ma ho nsuo no e ye kama. Empo so betimi anyinsa wo nkafo.
No, they na make can say. Prostate ne there and no produce seminal fluid no.
Right.
na nkwama no testis na produce nkwama asese bi o ye hwe ma ba na produce sa nkwama no and say sperm and spermatozoa na ye ka no but sperm no o produce ya no was store no bibi e friend epididymis
okay
na say uni ye form semen na sa seminal fluid no ena ye nsu ankwama no ye den ehia ametimi adware wom eni oba no ho kosia e ko oba no na se ni oba no kosia ametimi adware ni oba no kosia na ye akosia enti eye prostate ni produces our seminal fluid no not the spermatozoa what I say enti I said that should be made clear. So the function of the prostate is to produce the seminal fluid and is the function of the testis to produce the spermatozoa and they will be stored in the epididymis so that they can mix with the seminal fluid so that we form semen so ni anya semen no and then nsuo na nka say free ho ye den eba no
but cells be hwe say eye nkwamo no say betimi anante akọ the vehicle hia no nsuo no
exactly
add a tie say the spermatozoa no ho no enti nsuo no ebetimi adoso ama etimi akọ yia na te say prostate no hu hia pa
hu hia of course
okay mini an ehwe ni say enei ye ka prostate almost about synonymous with prostate cancer and then inside by prostate enlargement BPH in some now answer be do cramp no and nobody there's some myths be going around and they be say oh be my dear say utimi be month so utimi no ho ka fu sham be 20 times na ama prostate no utimi gina so na antimi kra ma ekese am be enlargement hu sensem pio afi obenya urinary problems dun so mun sem doc wakoye researcher yi na onim de ma bin kai eti for say me aminu Dr. Richmond Amo o say a clinical pharmacologist enti wadore mu enti onim de oka doc me ye bema ebia me a young man me fan say 35 ebia 30 except me active on pem na man prostate no aye adwuma yi ana doc who your questions so and them na bisa and comfort bisa me pa chopa
yes I mean say a lot of people I say doc literature be brand say juma research and people be brand I should say obi with prostate disease some of them are likely to suffer from erectile problems me can be so say o question abusa no obi I saw a publication I say if so we ejaculate 21 times in a month you stand a lesser risk meaning that
chances so be nya
prostate nyare ba make prostate disorders so e den e form
okay
but most of these work on is not really conclusive but there is a belief and I say it is believed say if you engage in frequent sex you can reduce your risk of getting prostate disorders.
Hey, and I said the man TT there so the what I say there are certain research findings be our site said bema there so tie and no hoka food din shemu it goes a long way to strengthen your prostate and put and predispose you to prostate problems later on in life
yes it reduces the risk
and my risk never from
say bianca me the cancer more ebia so if you had a emphasis kind to 0 to 10 I say 10 being the highest risk ebia so betimi aba from cry to 3 or 4 and I say be small across ebi cry unya be cry I just say but it doesn't mean say unya cry but then it helps to protect the prostate so for available literature that's what it's saying, but it's not really conclusive and work is still ongoing. People are trying to do various things to be able to establish that fact. Some even in some medicals they call it a myth, one way or the other. And in some one article I read, I think from some university, I almost can say exercising. So exercising in quotes the prostate, what you say, also helps to reduce the risk of getting prostate disorders. Then say, how do you exercise the prostate? You need to make sure it squeezes some fluid out, isn't it? And it is only through sex. And I say when you ejaculate, I say when you are having intercourse, that can happen, isn't it? That is that. It's not really conclusive, but it seems to show say there's some element of truth in that.
So that's a mantian, no better advice on one time. And Dr. Rubin are very fresh. He said, on tiny name in shame. Dog says,
I'm for 100 years.
Monk, that's on 10 shame.
Yeah,
okay, right. Therefore, Mutin you. I mean, because we are time Dr. Phil, of course, was Asempa 94.7 FM. Pacho is streaming live and so on our Facebook page was Asempa 94.7 FM. Asempa ni ASEMPA 94.7 FM. I mean, can say streaming live on Facebook and so time with Dr. Phil, time with Dr. Phil, and also and on. Doc, you're dealing with some of the myths and so. And name means doc what you mean so with respect to your practice, you know. If you say on so prostate cancer, maybe you have for the various challenges about the prostate, you know, but saying dealing with the myths, maybe you'll be a TCC na or TS you say prostate cancer. Just say winya. If I'm on sex life there, just after that jail cry. Now things I'm out Johnson just say Johnson I want to me na o dribble na said Johnson tribasa SL.
Yes. In terms of urinary symptoms, not so. I'm sure.
Yeah.
Thank you. Address it. Symptoms near there. Now will be sorted. But then, in terms of say prostate cancer, so no, the first part of the question, no, say prostate cancer, when you sexual issues, Again, there's some form of correlation, even though the available information I know in the same. Prostate cancer is as a prostate disorders themselves may not necessarily cause erectile dysfunction, but some of the medications which are used to treat. And I know be or treat prostate in your way, say enlargement to say cancer can really beat me the side effects, a side effect beat me the erectile problems. But through someone explained mechanism, so I think that people also with prostate issues are likely. Again, also it's not conclusive to develop some erectile problems.
Okay, right. And see, you deal with some of the myths. Now, say, and see, a prostate nankasa, and you watch prostate, maybe only peduanimo. Doc, inti obia or normal no, because so abnormal functions of the air prostate no, cause of a pepe. Na dear Ben sign a bit me a dead. Ama unipano. Mini abe moti bra kwesi bra kwaku ehu se sebi the prostate and ho touchima nema betimi adedi fanse nei unya malaria bia ho ya shiuti o ya wonumi onwono so ho debe na betimi adedi ama wo hu se prostate no sebi ho touchima.
You feel let's say because say symptoms are a bit dead when you pedue na say be dead when you pedue na mo be hu se me yanya prostate area. Broadly symptoms you're grouping into two.
Okay.
Your be friend irritative symptoms and your obstructive symptoms. Now because irritative, I guess be irritative, you say be can say be hot and I say maybe. Now irritative symptoms that means frequency.
Okay.
That's some 10 frequency, increased rate of urination, frequent urination. Urgency. Always there's that constant urge to go and urinate.
Okay.
3. Nocturia. Nocturia is an adjo. Obe catch a sink ye be obi was made that make me about 10 to 15 times. Because I be 25 times. If they are not exaggerating. I've seen people say that before.
Okay.
Almost about 25 times somebody day. And these are all things that can affect the quality of life of the individual. Oh no. Irritative symptoms, frequency, urgency, nocturia constitute the irritative symptoms. Now, you can say obstructive symptoms. Obstruction is a BB, ACBB. Makase, almost say, Johnson no could go your blood anymore. Ye Johnson, Druben femono, you find urethra. Urethra. In a part of the urethra, because it traverses the prostate. When I say part of it, a prostate in him. Or when I say prostate, you wrap a part of it. It is our part, and it's a prostate near Yakasia. Next start to say, a part name, and I say, Kemia's our part now. That will give rise to the obstructive symptoms. So what are the obstructive symptoms? We go back catch or say me jonso kakra bia on se fena ka me jonso ahodi na di akire no na osoro ba se me nyini me jonso ya say ahodi na from poor or weak urinary stream. 2 we also back catch or say me Johnson we ask mo Johnson be a day akam
why don't say we no
ask my Johnson we say be a day akam feel say me bladder mean the woman nyina my that's incomplete bladder empty.
Okay.
Obo also be catch us say me Johnson no e ba na mo pai me no what we call splitting and say fucking of the urine e mo che me no on say city no and also betting
now tete nkofo radio so Johnson pam no I just when you gonorrhea when you we and this how
oh me am cancer you see I must say all the symptoms we are talking about and of course if you are a man now already 40 years and above it could be pointing to prostate but then in your prostate in constantly betting these symptoms here I think we should make that clear what I say because some urinary tract infections can give rise to these symptoms here can but because in this context there can prostate one seminal and the other way then etuja on city obo so catch us me Johnson kwana moja den ewom obi so betimi catch us empo se me ne oba hia na se me hunsuo ne ba na moja den ewom on city no obi some also have hesitancy what I say enti sa no ma ya
hesitancy ne den doc
I say me kwase me nko Johnson I say
what is the Johnson do ba wo rade mo ko Johnson I say ba
obo so was training obechim catch us me Johnson a mechim san na den about training I say me kwase me gina senke gina e kasa yi no wa chim sa na bia afi na ba ko
so say nko
na ma yi these also constitute the obstructive symptoms now nti so hwe in these two categories o Johnson tentem o agency wo nocture anasa na dibia so ba Johnson bebre and say o sa meeting keke that's the irritative symptoms and obstructive symptoms so Johnson because se bia kem obo so se me Johnson ma pai me no obo mpo because me Johnson amoja wom obo because me koso me chema ansa na eden aba obo so ase Johnson ye den twetwa sisi on se necessity and I say poor extreme who sa no ma nyina na se wo ye be ma no wadi mfie aduanan kwa na you na say should be able to make moves necessary moves to be able to check on your prostate e bia now prostate na eden e bon kae you know so train man call a cell crown son why then what you want yeah
no so share you be brim higher Ghana and sometimes you know acquire the fire service approach you try ma BBSC na wo nipa mro na ase ya tuhana mo enti se yakase nei eye wo mema ho there's obote so be kase prostate wo ma ho ma ne mema yare oboa ti uti no time Dr.Phil say mema yare eto so biem no say mema yare there at what age doc and I say be me bi otie and show you I say na adwen koso at what age na so ko check in fancy obi di 30 obi di 40 obi di 20 time na me mama ni come prostate no ho
so dear 40 years because one of the risk factors for one developing a prostate disease is aging.
Okay, you know.
You know. What you see. Remember, it is highly recommended. So, we fear for a 40 years and above, you can check on it. But I must say, a lesser percentage in those who are lesser than 40 years or younger age have known to also have issues with their prostate.
Okay.
Even though they are in the minority, I can't quote any percentage now, but I know for the fact that there's a lesser percentage among the younger generation who also can have some issues with their prostate.
Okay.
But a greater proportion, those age 40 years and what above.
But I mean, it's for Nyana clear. That's a nipe biano, unya clock 40.
Bema.
Unya clock 40. I said, and so pay attention to prostate. However, so when you end the 40 cramp, what you are saying is that there are cases a bit about less than 40, so many
some
prostate issues.
Exactly.
Okay.
Exactly.
And that's the same fun as if we 30 so pay attention.
Pay attention, make me run a test. I mean, say some people are fortunate. Every year, be a drum, I'm running free medical checkup more.
Okay.
It doesn't cost for you to check on it.
Wow.
What you say? And say,
no bonny.
Oh, when they say but me did say no amount of money can buy human life. What you say? Because look at Impuna that you still have to buy medications, go through various whatever treatment modalities near there. So why don't you spend money to test? Check up on it. To know say, hey, come on, where the BB, but me chana me 200 among what you say. Right. Doctor,
right?
Doctor, me didn't fear the night. Me be say me share some prostate here then. BB come on. there are various things we can do for you.
Okay.
Why? You bet me actually moja test bako. You bet me put child scan I show prostate no. Doctor no bet me I be for digital rectal examination to find out the state of the prostate. And you be
okay. Digital rectal examination no and no kwan beso. And doctor no.
Someone for the dear omo pancha me. So doctor no bet me in such sebi or to hono.
What to kind no?
Yes, or the sabacom now. Yeah, you can feel the problem who the features of the prostate.
Okay.
But who the size of the prostate. What you say? Even whether or or better say input a ya. That could point normally when you touch the prostate and it's warm to touch, and that's it's painful and that's a tender. Or the patient expresses element of pain in the face. It could be pointing some prostatitis, inflammation of the prostate. Mobility of the rectal mucosa. Can he feel or palpate the median sulcus? I don't know. Doctor for my hand. Doctor. But all these things we examine now. Bet me say prostate within second a firm, a hard, a nodular in surface, and I say a soft. Is it warm to touch? Is it tender? You know, my doctor an idea. Even without doing the scan, I say one PS and he can have an idea of possible differential diagnosis. And I say yare bia. A bit me prostate, a bit me an idea of which one is likely to be affecting the patient.
By just for my main comment said prostate ya doc can have me that a Facebook page. It's about your bra Facebook na bra share. Na bibichi wadron say bia me ka say bia wo an experience with a prostate. Na ye the home come. My main comment say ne a Dr. Richmond Amo. Me nu aprakope na doc or Amo. KNUST hospital. Okay. Or just a doctor. Penipa. And I feel so no. Dr. Amo. And a friend is nothing in a Jumanabia. Doc, a Juman owns a question. A sofudi. Oh, a boo out me through profit to cover for copy. You have a larger audience. Gonna mind night you into the high and say, now, or say a consultant, a Phytotech Pharmaceuticals Limited. Phytotech. Now, Phytotech, about Phytotech in common. They are doing great, and they prostate ham member. A prostate ham member, and they are not to say, yeah, Pebby, a bit with that boy member, and Masabi. Nay, member, Nama Johnson, Edna, one ship, but never be on Johnson or Johnson. Sandy Manino, Essa, ya Shana, ya come doc. Now, minimum na a prostate issues, and they all can prostatitis, all can prostate cancer, what can benign prostatic hyperplasia, what can prostate enlargement, what can number C and funnel briefly, Marcum. For the various issues a bit me arise about the prostate. Maybe you'll be able to say, me dear, na doc can have me. Na ye front to doc, but the mess maka crabby monona. FFM, the various issues, challenges a bit me the prostate in the home common.
Good for me. That's it. I'm saying a good question because we had Omar more tape before you start your discussion. You know, you realize we'll be making emphatic say we name the difference between prostate enlargement and a prostate cancer. I think that was the third speaker.
Exactly. Yes.
I think it's necessary say a better
discrimination.
The okay, I mean, Kase, and yes, something new. I'm sure people have been on radio, TV, spoken about the prostate now and then. But I think we also feel that we should always keep on reminding ourselves.
Okay.
So, brand brain, you know, see a Jibrania, the Kakaya. So, maybe I mean, you are Maka, be obin TB, and I say you new, and I say no, but then it's important that we keep reminding ourselves, we keep educating ourselves and updating ourselves when it comes to prostate issues. Anyway, there are 3 conditions. Normally, and I say, Yarami and San a bit to me, I prostate. 1. Prostatitis. That is inflammation of the prostate.
Okay.
Normally, it results from certain forms of infections, particularly chlamydial infections, and also sometimes gonorrhea. I mean, chlamydia sometimes when you want to run a test, they do what we call prostatic massage to be able to get some seminal fluid to be able to run the test to pick the organism. Okay. Right, and you can get prostatitis from some of these infections from some of these organisms. And 2, your enlargement, you know. Did your busa question on TNA? Your cancer will name the difference between prostate enlargement and prostate cancer. Enlargement, you know, prostate na yakase. I'm saying it's it, you know. Ayakase. Now, ayakase, no. And then there are symptoms near the eba, but yɛbɛka sɛ is benign ɛnyɛ adeɛ a ɛbɛtumi aspread na ɛnyɛ adeɛ ɛbɛtumi ɛnyɛ kokram ameka ne saa. So the difference between a benign lesion and let's say a malignant lesion, cancer is malignant, a lethal, a bit more spread, and they are aggressive. What you say? A cocram, and I betum. So as impose one twin intimate to one more, it can spread to other parts of the body. But the enlargement, and I say benign prostatic hyperplasia, it's a benign lesion, and I say yeah, and your cocram, and I say yeah, the bit more spread it. What I say, and I know the bit means why then. Just that it can affect the quality of life of the individual, especially if symptoms have a bit more. So yeah, not in a city. And the difference is what prostate enlargement, any prostate cancer, and I'm there, media I at
Okay,
what I say.
Right. Okay, the difference between prostate enlargement and a prostate cancer. They're not only what share. And see, what of the other conditions associated?
There are 3 of them. Now, prostatitis, when the prostate is inflamed, and a 2-year enlargement, prostate enlargement, and I say BPH, and the third one is prostate cancer.
Prostate cancer.
So these are the 3 conditions that will affect or that can normally affect the prostate.
Okay, but say any interactive na nkofo yen reading nkofo questions bebre aba na yen fa no free hunt ebe kakra ebe read them questions yen share Facebook there but omombra Facebook na prostate no yeka ho asem ye ato ho your images so how kwa o hwa ebe ma wate eye de yekan ho asem ne yen Dr. Richmond Amo or a medical officer or a clinical pharmacologist or a Phytotech Pharmaceuticals Limited and a Dr. Ruben Agbo on also a boy a nebra penny Dr. Richmond Amo on also free the Phytotech Pharmaceuticals Limited and they share prostate and they want what's has a prostate a prostate Doc, obi so share some kwanza so share live no yen share yenua Joe Asante edina wabo no se wahyehe Joe Dr. Asante yen
Ruben de wahyehe na
your boss ID no ha
any Ruben nickname
Ruben nickname Lydia Teta Smith also can untreated prostatitis and enlargement lead to prostate cancer?
No. There are there are different pathogenesis altogether. Why?
Okay.
Until the lady should get it straight.
Okay. Right. Piaga. Also, good job, doctor. May God bless you for your good job you're doing for Mother Ghana or text here from Achema Safo. Massa, we want to see the doctor's face and not the lighthouse tower. Hey. Lighthouse tower. Georgia Timu. Good topic though. Okay. Now Facebook Pacho, there's a reason why and they yearning the COVID abba inti and your lighthouse tower share the N95 mask no. Doc show mask why show mask Lydia Tete so the prostate is very important. I'm so assume or say Georgia Timu doctor, please explain to the quack doctors and their patients that prostate is not a sickness but an organ. Meaning baby I say bim say na prostate na yare na yare organ. Gidi Duku hey winia Dr. Duku also Dr. Abajuma Dr. Duku Mechao echina ese nkomo kra ho but we divine so share from Abakala Pass John Owusu great na nije ho Frank Bruno senior Frank Bruno say na nije ho na ye be no brief phone lines be say na ye ne kofo bebedi edin komo na yeti questions until wait me so afre was 030-221-6545 doc na say no ye king prostate what share baby award made be ma say wan hwe prostate kwampo wan hwe obetimi anye menu aba no wan hwe na ho kwa asem no obetimi akofom kakra nti ade hu hia doc a kire say wunya di 40 a so tu na man kokko hwehwe na ne nso no hwehwemu am ehu say mpo mo ye below bi 35 e mutim nya issues nti nya say wo twa ma 40 na so wo ho ada wo ye thorough check up na the prostate na fam ti doc pacho ene test ben na mpesa me hwem prostate nsi bibia dadin a ese me ye test ben.
Okay, so Phil, your normal means commonly which can be routinely done. The first one here, Umuja test PSA, even the prostate specific antigen. I know your Chumoja ni akoshesa the level of the PSA no. Based on your age, some ages can be some specific reference ranges. And the doctor actually no show age, no show reference, and maybe a cost so baby. Then it will give the doctor an idea of a possible problem with the prostate. But I must say, there are certain things which can affect the levels of PSA. No matter why, a bit to me, the levels of PSA then are control. Not necessarily because the person is sick.
Okay.
So many factors can affect the level of PSA. So before you get to do a PSA, I'm sure if you talk to a very good laboratory scientist, there are do's and don'ts. You have to do. There are things you need to abstain from. Even sex. Somebody I've seen a literature saying that it's recommended that you abstain from sex for at least 24 hours before you go and do your PSA test.
Okay, test now.
Yeah, exactly.
No,
yeah, and I'm gonna say these are things.
Monday. If you Saturday and do Sunday, no men call it.
You can stay for about 24 hours.
It's when you the true value.
Exactly. I just also could be semen analysis. Semen near 60 away for 4 to 7 days, something like that. So several. The point I'm making here is say, even though you says a piece in the kosra, it might indicate say it might indicate a BB prostate no, and I say be prostate no.
Okay.
One, it depends on the level or the margin of elevation. But apart from Yariwan, also there are other things a bit are affecting a bit more PSA. A doctor can also do a clinical examination. A bit me send them digital rectal examination. Or say you share I don't know what big feeling for the prostate. And based on the features of the prostate, his clinical findings, as a wash share, why yes, I didn't have for feeling for the Indian be also beyond based on the Obehuno. And also bit me my doctor an idea. Say, this prostate is likely to be this or that or that. Because there are clear things the doctor is likely to find. So the necessary for no examine idea. So and to be a specialist, urologist near the baby also when I'm going doctor and necessary to any sort of necessary to take care. I'm sure be explaining actually say for the prostate. And these are the things and it's important. A bit doctor clinically to pick a lot of a few signs are. A bit me abona man enhancing the judgment and I say be man the judgment now be jina so akase every na year no you say. And the third one, people can also get a scan done. Abdominal pelvic scan, you can do a scan now wash your prostate now. Your prostate in the case here any crowd so we are the academy are there. Then no so scan be ma those from urological scan so be certain things and so be board doctor no so am let me akase say and say. Now so your PS and sasa kosro bebre pa. Some of the specialists will recommend is a beer or say obehia a biopsy. So what do I mean by prostate nekakra? So near their collab, near histopathological assessment. I say you be histology. Prostate tissues no say you could from the them say just normal enlargement. And so if it's so high, they want to do that to confirm say if indeed it's prostate what? Cancer, and they can even use that to stage or grade the kind of cancer where they are. And it depends on the findings, of the PS, the levels of PSA. And I say that the findings are doctors be who say be ordinary such as be nipa na to no. Then be kabuma, be man who say papa die me sha e betimi a prostate cancer. Oh there be cratchy die dem have prostate enlargement, or even based on just my normal digital rectal examination, it might just be a normal prostatitis. Say no some me manage patient no. It is normal me saying so the when to me anya hwe kra na your PSA. If you have a good doctor who is your doctor, you talk to him, you want to check on, he will do that for you. He will do a digital rectal examination, tell you what he thinks. Or you can also do a scan. The doctor can also request a scan to look at the size of the prostatic volume and all other things to make sure it's a BBI then come. It's a problem also. Doctor must be catch us a problem based on the findings or the information available to him from the results and any normal way that you see. Necessary. So maybe also the boy be another day or the well.
All right, Dr. Richmond Amo, or your clinical a pharmacologist or science consultant or a the Phytotech Pharmaceuticals Limited. Na we de and come fa a prostate home. Bibia, you need to know about the prostate here, bro. And these are the experts, especially coming from a Phytotech Pharmaceuticals. Me, I made you dance here. On my akoda enya yen nwa itimi bua pa with the prostate. Na very soon remember the opportunity no maka ho asem and they show the prostate na it's in order. Say better kwaya making you be a wa wuti. So when your challenges be now who be on farm far. Maybe there are certain medications and our recommendations but to me at the amount na and also aboa na the question be ha and they bra Facebook never share a kwanya fast so fa biopsy no the biopsy gun no ho doc say they see fa sample no near they said all kind no na akwa say o de na ekokram ana say ekokram say prostate cancer na enya prostate cancer na kwame tete ebusa say "What's good evening doctors, please can prostatitis be cured if acute for a long time?"
Oh yeah, it can be because you have acute prostatitis and chronic prostatitis.
Okay.
So it can be treated depending on which organism or what is causing the inflammation.
Okay.
Once the primary cause causative thing is known, there are always medications to deal with it.
Okay. Marincha the general overseer of the PWC Paradise Way Chapel, brother Sunshine Adams. I say doc, the need your na education way. I say yes, 40 years and above. Now I'll say main country said the doctor is good, and we thank God for your life. Doc, I'm say, go for any ajo na no. Ma send it into. But I mean, come on, it's a great topic for the young Christian guys not yet married and not intending to engage in premarital sex. What would Doc advocate? Doc, but what you?
I say,
we a great topic for the young Christian guy not yet married and not intending to engage in premarital sex. What would Dr. Amo advocate as a practical way to protect the prostate? Kudos to all my young guys listening. Jonas Tinkran. That's what the question I see. Say yeah, my bit of credence to the fact say sebi o tano o kafushie mo no. It's me by extension bought prostate no buying from risk of some of these prostatitis, prostate cancer and so on boss no. And obusa say na me a young man ja me de konkron merade na me nka se me de me nyama do se me de ho beka obia ti sa nipa no kwan be no befa no ho obefa so abo ne prostate no ho ban.
My question I say
and I said that what say and say uncle for routine checks me ba na o ha ko check it yanka say when we kwa issue man say
I say I can say I say the point has been made say from one article I said also 21 ejaculate 21 times can help reduce the risk of developing certain forms.
And no questions about yes 20 is a bim some dey adwuma. No I said busa doc, almost busa doc but
but the point is that the most important thing is like you said as a Christian and all that abstinence is important. I mean premarital sex based on religious beliefs and that's based on an individual's religious belief. If it doesn't fit and suit well with your religious beliefs, you don't have to engage in it. But that doesn't mean that if you are not engaging in it, it means that you are going to get prostate cancer.
Exactly.
Or prostate.
In fact, you haven't said
no. And you remember we've made a clear point. Say most people who develop problems with the prostate, they are normally in fear 40 years and above. But even though it says a lesser percentage, and those who are in the minority, few who are young are likely to experience some prostate problem. It doesn't mean that they cannot experience it at all. Which I say, even though we know most of them are 40 years and above. And you also encourage, I think his message is even advising us already.
Yeah.
Say as much as possible we should abstain, per religious beliefs. Per religious beliefs. Say if you abstain, that's also fine because as a young man, if you marry, then you can go that trajectory you are talking about. And you say 50 times per year, it's up to you. But per the religious beliefs.
Doc number 2 enti kasa check en confirm ko test if I say maybe 40, maybe 35, and they wait your time, Dr.Phil, they can prostate one them say, oh, how I check your prostate, we couldn't go scan, for your PSC test near the day. How often?
Oh, the 40 years, you can check at least once a year.
Once a year.
Especially when you don't have any symptoms.
Okay.
Okay. So any symptoms, you can check it once a year. If you have mild to moderate symptoms, if it's 40, you can decide to check it every 6 months, or twice a year.
Okay.
Because as your age advances, then the number of times you are supposed to check on it should also go up.
Right.
So it's advisable. Sometimes, cost implications and things like that. But then, repeatedly, even if you don't have what it takes to do it, at least once a year wouldn't be bad.
Okay.
Or you're on a fact-finding mission. For there can be an incidental finding. Only symptom be a also where the test na mention. To be a finer. Okoya say the PS and maybe a baby brave.
And no
symptom. Then now they go in and say, okay, then let us repeat and see. You must repeat it. Next, I was to be brave. Then let's do a biopsy. And so we have come by biopsy then. Cancerous.
Okay.
What I say. It's good to check on it. I mean, prevention is always better than cure.
Right.
And once near share near who no man in terms of say na you near who be how in Tama. A bit me abuama intervention on here so a bantem. I'm aware day. I don't quite day. SEO.
Okay, I have a question back. Obviously, say, Mimbusa, Dr. Phil, please ask Dr. Amo for me if masturbation affects the prostate. Masturbation. Doc, what do you know? You know, when I may announce phone lines and I bet answer. And on my way to me, I've 030-221-6545. 030-221-6545. And I said 030-221-6546. Doc.
Yeah,
friends, maybe I'm a free, maybe a second senior high, and they say kind of senior high, and they metro train home, we introduce me come, metro train home, be seen. A bit may affect me prostate and a dog. Now the dog, Baba Hona, ebe answers our question. Now, Mammy called Dr. Ruben Agbo, so doc, in team patcho, ye can maybe I'm issues with my prostate. Now, and they share the management, and they hono, point bit me a faso. Ashe me de be because I believe in the Africans ye ho no momo ye scientists there kwan be na obi betimi afa so I'm managing the prostate and say akosra nti doc
okay nti min kasa
doc pato ma obi kasa match your voice.
Alright, okay, min kasa nti person min chia eti for any ashefo e wo Facebook.
Right.
Alright, nti obi ewo prostate yare ana ebi a wo ni prostate yare kra obetumi aye niam we I betumi aboa in terms of prostate management. One thing pa etumi affect your diet. Into diet no ye bati say ye normal fruits and vegetables. Because fruits and vegetables are one of the vegetables are ebua pa tomatoes containing lycopene. Tomatoes are very good. Into we bema maybe fresh one no etumi boa. Into ata nsi chichi mekumawa momun chichibi enguso emao. Even rice ka ometumi chichibi eguso ama. Into most of the things are wood masa niama no entumi endorse ewo weduane mu etumi boa prostate no ye pa. Into we de wo bio uni bio tomatoes are very good for you. And one fruit etumi bua pa in terms of prostate management watermelon. Watermelon so ye very good pa. Ain't at least once a day dear, especially you want season but more than say obetumi di watermelon more. And also to me bua pa.
Oh, I see.
And me can diet no so me ba in terms of your protein in terms of nama yedi. Nama entumi bua prostate no mojanam. Into woody mojanama and boa prostate no. Me can mojanama red meat.
Okay.
To say me pesa me bubo some of the beef, red meat exactly and no and boa prostate no.
Okay.
Into pesa will manage will prostate yeah. Train just stay away from this kind of red meat. Na can be your crap this kind of dry fish no. And those kind of things. And nuna etumi ebuaye in terms of your health.
Okay.
Into we yes anyama na etumi ebua. Exercise into one of the factors etumi affect your prostate. Into we bon say doctor kasa from the beginning no exercise we uta exercise etumi bua.
mema no we this kind
exercise
of
in this case no sex no so yeah exercise
exactly you are exercising the prostate
okay.
exactly and sit-ups what are your sit-ups and also to me eboa and I will be a friend of casual exercise.
Okay.
I say we strengthen pelvic muscles no
pelvic floor muscles
exactly we yes I am no so to me eboa into your diet aduane a ye di ye exercise any sa na na ye like if we are able to take care of ourselves exactly
you purchase your lifestyle so lifestyle modification we exercise do any dey mu ye na ti me boa my prostate ni gina so
exactly we yes I am na e betumi aboa
all right chia gift Philemon Mensah Tito papa Tito mama Fred say me ciao na anti Felicity so me chiamo ama mega say so me chiamo doc bacho why ready obi so for masturbation yem fa call wait me 030 221 6545 030 221 6545 and I said 030 221 6546 Asempa 94.7 FM time with Dr.Phil 030 221 6545 and I said 030 221 6546. Hello, good evening.
Hello, good evening, doctor.
Yes, Minia Udini baby are free.
Dr. Phil, let me share with what it's my complaint.
Amen. Yeah, that's Minia Pachomanenko.
The Mokano. My experience is going to be prepared. Some Johnson, this is a man we air me. Now Johnson and Sono, and Quimba Street, about cra. And basket I could flu. No, about crack, and to we say no. I said, if you have a quite check here now, say, I said, I'm going to say, the copper prostrate blooming nato, because I'm quite checking first, and I have a copper prostrate blooming.
Okay, all right. But on Doc Ben no two question and nti pa fato so na de tie why na nti be fa more questions why yeah that's pa me nya me sure. All right, wait me after 03022165545 03022165545 and I said 03022165546. Dr. Richmond Amo ha Dr. Ruben Agbo so ha mamika said Dr. Ruben Agbo MH Osaya consultant so Phytotech Pharmaceuticals Limited omo akwadare wo prostate sensitivity e de omo ba be chechem 03022165545 030 oh okay you must see say your phone lines and challenge kakre bia bamti by enche you be fa course no doc pacho me so why you ready na ene metwetwe me ho now so what can be so far say na ye hwe prostate na ye the DRE no ekoye digital record examination ko fa to na see mu na discussing in our sex and science and some into two questions I want to ask you. Me bema na me fan say ye ta fa meto so ho any implications if me prostate ho ana doc
I cannot really say there's a connection and I said there's any obi again obenya BPH and also obenya prostatitis and also obetimi anya prostate cancer.
Okay.
That I wouldn't want to draw that conclusion, and as a main person, I kind of straight up say sign a bed ABC.
Okay.
Right, yes. Okay. And back to the issue of masturbation. It's a bit hazy. Various people have done a lot of work with regards to that, but still, some of them arrived at different conclusions. But there's one conclusion which readily came to mind. I want to read it out by a team of doctors who did their work. And it's what we call Polexeni Dimitropoulos et al. Well, according to their conclusion, I'm drawing is frequent masturbation during men's 20s and 30s increase their risk of prostate cancer. Dimitropoulos tells WebMD, but men in their 50s who masturbated frequently had decreased risk.
Hey, not just so we are younger. Not that to show one.
From this study that they did, I think they
from no.
Yes.
Not just say woman no more much younger no. 30 year no. Not they were found to be masturbating.
An old publication. That's an old work. The work was done in 2009. It was published in 2009. Yeah, but it's the information from what they concluded.
Right.
Is what I've put out there.
Okay.
It's maybe subject to
international link.
Aha.
Doc, I'm saying Kofu Gulan is me. I announce
Okay.
phone lines 03022165450 03022165545 and I said 03022165546. Asempa 94.7 FM. Time Dr. Phil and Neye Camp Prostate. Mini abema o Johnson na emba no o Johnson asibu akem and o Johnson crampa bonsa o panty mu na etimi ba be good trousers and it's so embarrassing bonsa o rock what akino bonsa call washroom by Johnson no atwea ema egu no ho yemfa calls. Hello, good evening.
Hello, good evening,
doctor. Yes,
if I try Francis, make us have home.
Okay, Francis, I'll free so home patio.
What the question has to do with urinary tract infection. If I show many symptoms being symptoms within a month in my hospital. Now, yana is shooting them and one has them and wash me and mukau bisa. So, me call my antibiotic, your woman injections, but main tippings need biomudi, but woman, sorry, Diana, me who's in Sufi, be film them and soon yellowish from this. I'm patient because I say, I mean, Nimara. Say urinary tract infection or mokan and no na minimum say
okay. All right, I'm saying now question. No person find out and so before be am but person find out what it is before. All right, okay. In the end you near trade diabo ampofo or also on Facebook or say or share from Germany na program no educate me near John. Hello, good evening. Wait me after 0302216545. Hello, good evening.
Good evening.
Yes, sir. Pacho Udin, baby, afraid for me.
I'm Pacho Macasefia, my dear boy.
So, Pacho also Casefree.
Pacho Sioko.
As your call, okay, it's your winner.
Then Samanca say, Madame Pacho become the master minister of my power was in church away. No question, no money, tea or Hanuma.
Said, in Swato, it's your call. I don't know. Young fat next call. Hello, good evening.
Hello, good evening.
Yes, sir. Pacho Udin, baby, afraid free. Okay, Bra Isaac will feel labadi, Pacho Etio.
Sometime we could that say at the time that I test on me, and I not Johnson, not me getting a can I said you saw them. No, I could use some better treated by say me that pen and the family and the event if you do mean so be my go to best idea. And I sometimes also Miss Solano Panama Johnson.
I'm on fan chair, I'm set your lines, and they mean say in so tongue kind. Hello, good evening.
Hello, good evening.
Yes, sir. Pacho Udin, baby, afraid free.
So much me prefer Kuma.
Okay, Pacho Etio.
Simple. Because me say doctor say me tell you now pa na no see wetin affect me ana.
Okay. Pacho also question and no I don't know. Right. Doc Pacho Obin so Pacho note and so ma na etimi afa questions no more say o na dwuma o ye no gina ho che. No person find out say dwuma e gina ho che security. There. No. Say hello, good evening. Right. I'm saying you lose no 0302216545 0302216545 and I said 0302216546 Asempa 94.7 FM. Time with Dr. Phil near Patrick is saying okay, but my Patrick Udini be free. Patrick you man call.
Me person me be fast say ukunu bibi tunisa na woni ni da insusaso no oba no obenye bia na
Doc Pacho note no so mama question bia ehun mama e da se pa se wabusa question yem fa next call. Hello, good evening.
Good evening.
Yes, I'm Pacho Dean baby free. Okay, Brako jo etio.
Many are more than 70 years.
When you're more than Pacho, a Japacho with my man, so cry, mammy, saying hard near.
Many are more than 70 years.
Okay.
Now, a done in the family, so baby.
Okay.
I feel me in some sort into me in flu, papa.
Okay.
Now, you have my ass into me and here. And the person who said, I put it on her.
Okay, eja yedase pa. But say a question and one no. Okay, jump at your fato so na yemfa Doc, okay, Budo. Budo all the way from Canada, so we can just say ciao pa. Now we and any pa. Right, wait to me afre. Yemfa a last call. Yemfa a last call 03022165545. Hello, good evening.
Hello.
Yes, I jump at your Udin baby afre free. Dada kusi from Accra pa to ATL.
Yo, the person can say before pure and not boy, you know, we are no package. Before pure, Mamma, the upstairs, Mamma, but before pure upstairs, they don't want to defy the body, the temple of Christ. But if you look for a girlfriend, or they define the body into abstain, and also on your day. Not concentrate within the youth, but we jump in the front.
Okay, ja, pacho a dog bear and sounds is here why. Yeah, they were to pat fato so na. Fiemfa course ninsia na Yembra studio na. Questions they bring so on Facebook na yemfa. Dog pacho, I hope so no T questions ni na. Nti yen shoot too.
Yeah, I'm saying one guy be fair from Sunyani. But before I me start, I must say as a company, I'm here to help educate the public. You never see a church, you be charging near the educate the public, you know. As a young doctor, I think that should be made clear. The rationale is for what? Health education.
Right.
Seen a bear, Nindica Crest, you want you want your mom for you day. And the purpose of our discussion is to help educate and even learn from the people. Because the questions will be, maybe a question, but it's very, very critical. It's one of the key misconceptions people have about prostate. TMC address it. Now, first question now, guy was also home. No, Cassie, so Johnson, Tentem, na Johnson, in so fitabish in the Bemman, so yellowish in the Bemman Baniade. Mamma Casse, we are not here. Also, you need to say, you be diagnosed soon, confirm, as you be can't. Dear how be or reduce watching and I say what we advise and say oh symptoms here na go straight to a nearby hospital and as a call I sabia wo koja sa wo kwa hu doctor chechemu chere no doctor ni din komo o chechemu che obaye hwehwemu say your prostate obemo hu what you say now obemo the necessary and the needed intervention also there here
right
because sometimes when you're careful and I say you maybe somebody presenting urethral discharge frequency, dysuria, you might put a diagnosis out there. We don't want to do that.
Yeah.
But advice some people say, so they will symptoms when you know. Call hospital. See your doctor. Talk to him. Explain to him. What you say? The doctor will intervene. That's the also this guy quite is fortunate. Also, on what they are starting an antibiotics in Ruby already offer. So for complete your medications. So we will know as a still now feeling fine. You can go back to the doctor. There could be further investigation. The doctor make me a the one I'm in fear whom part the property pie this a honey by no idea was one amount. Two, but also besides say, or yeah, Juma wo Ojina Hoche. And I'm not affecting the prostate and I have not come across any data or any information that says Obia or yeah Juma Ojina Hochebia is likely to develop a prostate disease. Me who be beside anti that correlation no as I sit here no I don't think say it's there. So remember the panel and yeah worried. Say bia so Ojina Hocha obenya prostate because you can carry risk factors near that. So Ojina Hoche and I say we know benya prostate cancer and also benya prostate enlargement. No, and also even prostatitis. And mommy be question and I make you also busa say or say kunu of prostate issue. Na se kunu ne da ono so betime nya bia na. On see a started discussion. Me can be 3 times. I made it categorically clear say emma any prostate. Prostate
kunu down so na the best out
there be there na I don't need inside area it then clears that misconception I say prostate no ye mema nko na prostate
okay
man ni prostate what yes and the fact so kunu prostate ya ne nche say oh your banana ne da benya say you benya prostate me okay I think that should be made clear
right
and obi busan say o see we over 70 years or Johnson 10 kakra bia na eba of course we o chem Ebi also do something na see then ya. These are possibilities. It's possible to be symptoms or even by they are symptoms of prostate disease, especially the fact of 70 years not say bear man only these symptoms. But Memenka say there are other conditions, other things a bit so these are symptoms here as well then. Aba. Until like I said earlier, no on call in the hospital. And that's when the doctor or channel. Na onye we say onye nhwehwemu and I say on examine no onye labs no confirm say indeed say prostate are any bia no fa no to adro say na be ya obetimi edey enya the desired relief or edey open. And I think the last question was I see my nyane yede but am say the all can say what advice you be ma elderly men almost abstaining. Of course we didn't just say engaging in frequent secondary ejaculation the only way to prevent
Dr. Ruben at exercise Kegel exercise
tomatoes common tomatoes watermelon and all these things are there. Okay, when you take them and all that you what you should be able to and exercises near there. Okay, it is and yes and say if for one reason or the other you are abstaining. There are other things you can equally do to help protect you against prostate disorders. Okay. All right.
Doc, now, I say, will you get prostate when you don't release sperms in your partner, but you quickly remove it and release it outside? And also, your boy Scout, I was watching live from, I say, German, thanks for educating us always. This is Sammy. Hey, Sammy. It's saying we were together this afternoon. Georgia T. Monsi Great Show Doc. However, is it all right to buy drugs over the counter for prevention? And I also said that meat cause prostate enlargement. Doc, quick one, a timer song.
Yeah, I can't read meat once. I think one of the risk factors are ruby balls. No. And the first part of the question was what?
Over the counter drugs.
Yeah, you see,
over the counter OTCs.
Let me say that there are natural remedies which help to prevent or protect the prostate. Okay. But Mamenkawe, people go out there and say we are treating prostate cancer. It can be a dangerous thing. If for one reason or the other you've been diagnosed as having prostate cancer, it's appropriate for you to see a urologist, your specialist. He is a doctor who is specialized in treating prostate diseases. It's always better that way because there have been instances where maybe because say we are advising my name find a drug crab on Janon for sebisebio manusystem concoction be an answer be analysis and yes be no. It's good, it can help up to but you share the nature and the severity of the disease and son I employ who said the mother patient. Okay. Yeah, because so when you're careful people will also tend to but then there are other things which are good natural remedies which have been formulated to protect us from getting prostate diseases, to improve prostate health and also to enhance its function.
Is a fight to take for so more share in Darga, more or Honso.
Exactly. Because what the products factor bring on the market, most of them is coming out of extensive literature review, while various works in numerous scientific work which has been done. Then we have reviewed the literature and we've taken it to the next level. Yet they're free, just sitting in the shelves or in thesis and order to the next level where we are developing products, quality products from it. Will be also a benefit. Anyway, but like I said initially, our primary aim is to educate the public. So yes, share. And I make I said, yeah, can this is the first time you be but it's a constant and a gentle reminder to ourselves. Say a brand you budget brand as part of our corporate social responsibilities to educate the public, to share knowledge, the little that we have, to share with them. So maybe almost making a benefit from the little knowledge that we have.
Many I'm sure last words and they Ghana for the education abroad for prostate. I think it's been good. Me and come messages na patcho man kan there nyebo apayo me for di bia ma me me for di bia ma no me dili e we che wie so na mo de na mo numbers be to dwan so na mahwe enti doc patcho last words prostate obenya prostate o say yen kon check at least say once a year at least once a year the obetima call hospital akọ nhwehwemu ahwe so prostate no obetwa scan no your PSA say levels no cost through or not but last words
so they make can say you need to also 200 more we din fear we be man na we din fear duanan kwa 40 years ago na me man nye wa hu ahia de kese ohun ade be hia so be ye de check up on your prostate. What I say because it's also one of the conditions that can affect an individual, can affect your quality of life. I was in the city, and men kind of simple. Don't just see it as if you're prostate. You can't. No, it's something you must take steps to check on it. It's very, very important.
Okay.
Also, me catch us. Even there are people who may just say, "So, maybe I'm going to test keke." The over the PS and was super brain. Doctors will go there. ABR for the first time. Be in a man course with my means and repeat over here. Next, I super brain. And I'm going to biopsy. I mentioned. Or biopsy. I'm going to say be a prostate cancer.
Wow.
What yes. And you know, it's important from time to time we check on it.
Right.
Them say, I mean, Bobby, me and asking me, I say,
Bunio.
I hope bambo atrema. A chain, a drug grawama, meaning that prevention is better than cure.
That was Dr. Richmond Amo. Dr. Amo, a clinical pharmacologist, the Phytotech Pharmaceuticals Limited, was I consultant for Hona. Dr. Ruben Agbo, or no medical herbalist, or Saya consultant, a Phytotech Pharmaceuticals Limited, but a prostate moon, dear on my extensive work inti and then nim dear on time with Dr.Phil. Medium GDS say oh yeah Pacho Kofi Gaddafi bra Kofi Gaddafi bra tenase Kofi at say
no nyamiadom
bibia da di
kidam ponyankopa da
right now you say Kejua you say best foreign sports presenter
undoubtedly
okay now and no what something to say
Focus Media Awards 2021 edition and Edru so na dog when him say Ghana dog another na metikem na toto da bene biem oti an performing bit no na passengers menu nya kasa osiom waso ade structure mo eruko ka bibi nti wante ndo mo musi odo musika mo musi
ebu ha kasantem ho o kaswa or rap
oh, so or
rapper
or too good
or old rapper.
It's dog. Focus Media Awards 2021 edition.
Okay.
You're nominating for the best foreign sports presenter of the year.
Okay.
And your positive flyers in the form and congratulations in advance of that. Dog, but voting in the bedding, a betchery.
Right.
Dog into voting, no. A such name you do much water.
Into person chess a man conform for man.
Debbie, who can't be young voting? Who vote here? And a day award never be
okay.
A percent be fee.
Okay.
Inti a best asking me on Monday, voting the best asking me on Monday. Na Udokra say Yamu said in our crow. Doggy dial star 800 star 400 ash. Oba now call no more. You will be say code no about 51. I look at see the code near 51. Into now about 51 now. Now I call. Dog into very, very simple. Dog go code na me boss na star 800 star 400 ash na okwa ebusa code no abo 51 ene eruko code into 51 now okwa straight na ebusa say how many times you want to vote no vote back ko say 5 pesos per
oh 5p
5p 0.5p then maybe 10 20 30 now vote ko
and we are 50
because vote
50 Dr. Ruben 50
Obia 50 until Monday Obia be 50 time Dr. Phil team will also be at 50 Monday na be anya fine the voting be end 24th of April and just see a tune in term Nigeria award no convincingly na be 20 minute come and focus no you know na me admo Saturday dey be so akopem say dey award me be fi na be come
right okay until that was deputy producer Kofi Gaddafi. Now, Dr. Ruben, me pacho mo number no Phytotech Pharmaceuticals or more mania prostate issues no in case on person mo reach mo number be no mo frame also.
All right, okay. Inte o person reach here, o bet me a friend was 0246 490 116 0246 490 116 It will bet me a friend from Monday to Friday between 9 a.m. to 5 p.m.
Right.
Who friend will be able to.
Doc, yeah, that's say. Into ye the best na ya pa na ya say na same comma me producers Eric Esidibu very soon to be crowned the best foreign sports a presenter or no dear no. That's like I said, producers Eric Sedubu, the Adom Star, Kejuan and Kasa, and Kofi Gaddafi, Patrick Ewusi, and the ever adorable Grace Mensah. So dance on Koma, Sante Fabrics and West, when Nija Tade Shemihua, now the Nasia Cassia Pai Mazze Sante Fabrics and Wear. Wait me from 0246 899 667 0246 899 667. We are Bema now pe kaftan or patadi bi ashe, but person represented the African now offer 0244 217 314 0244 217 314. And no Biff's Creations Biff's near BIFS Biff's Creations. In the base here na yada wase. Like I say, Nyankopon or Tiase. No enokwafo say or enokwafo pa that you share we have overcome. Otawachim kwandia, you'll be an overcomer. Now to send time with Dr. Phil, another exciting edition where you're most authoritative, your most educative, and your most interactive health talk show. Dr. Phil nie mini afro ho si yo ate. Hwe nyame